according to the official records, there is over 1 million IDPs, and they are scattered, staying in different locations. Some of them are staying in camps, IDPs camps, internally displaced person camps, and other staying within the community. And some of them are staying in the government buildings, something like camp-like settings, but they are not officially recognized as a camps. So the major challenge that the IDPs in the Benue state are facing are mainly related to, first of all, the protection-related things. But for example, if you see people staying together like in one classroom, like more than 10 families, even those who are staying in places like camps also having serious issues related to shelters. Besides, also we're receiving, as we are working with them closely, we're receiving also complaints about the food. The state emergency management agencies doing their best, but the needs are huge actually, and the number is big, very big. And the biggest challenge is that there is no many NGOs, either locally or international NGOs, who are operating there to cover the needs, the unmet humanitarian needs there. They have also challenges in terms of health, especially areas that we are not operating and we are not able to cover everything as the MSF. So there is many needs and many challenges that the IDPs are really lacking, and we normally work together with the Ministry of Health and the SEMA, the State Emergency Management Agency, to coordinate. We are supporting them in terms of medical activities, water and sanitation, and shelter as well. Also, as MSF, we constructed a number of shelter in number of IDPs. So those are some of the major challenges that they are facing actually. For MSF as international humanitarian medical organizations, we provide services regardless of who is the person receiving, including the host community. They come and benefit from the service that we give, especially in terms of medical services. We do not only focus on the IDP camps, but also people from the host community surrounding or around the camps, they also benefiting. For those, the IDPs, we are currently working in Ortese camp. Ortese is an IDP camp, but there is also host community around those areas. For those who I already mentioned that living within the community, they are not living as with their relatives together, but they are having their own setup, like as I mentioned, like living in government buildings, or they also put up together something like small shelters whereby they're living, but they are not recognized as IDPs. Recently, the new SEMA administration has recognized so far a number of new IDPs camps, but in the past they were not recognized IDPs. So when they are not recognized, it is a challenging because they could not receive services like the other IDPs camp. So they are not integrated together with their families inside, but they are only living together inside the community, if it is not a camp as such. As I mentioned, these are the two categories who are really facing a serious challenges as being displaced persons. So for women and for children, of course, it's really challenging when they are displaced from their ancestral land. So they face serious protection challenges. This, especially for women, like the domestic violence, sexual violence. So when they go out for farming or collecting firewood, they being raped according to the information that we are receiving and cases that we are receiving. Also, with their inmate partners, also there is violence, because when people are displaced, they face several challenges, like there is no work, livelihood is become very difficult, a lot of things. So even the intimate partners are start by violence, and that is exacerbated the situation for women especially. So MSF provide several activities in terms of HGBV. So we provide like mental health care, psychosocial support. Also, we provide also medical support for those who are victims of sexual violence. And also, we refer some of the cases which needs further protection support, like shelter or livelihood or other protection support that they need. So these are some of the support that MSF provides, and there is the major challenge here is that there is a huge gap from what we are seeing. The number of the LGBTQ cases, people who are victims of the sexual violence, are a big number, and we are not there everywhere. We are currently having presence in 4 different LGAs and with 8 different sites, but the number of IDPs is scattered across the state, and the number of the NGOs who are supporting are very limited. So there is huge gap versus huge need, humanitarian needs, and also the other things also in terms of reaching those who are in need, and also increasing their awareness, and also coordinating with the limited number of NGOs that currently exist, also another challenge. So there is some many challenges that really we are facing on the ground, and the availability of the service also another big challenge, which is also lead these people to suffer more. As a medical humanitarian international organization, we really we are with our principles as international organizations, which like independent, impartial, and also neutral. So our services are available for everyone, even some people who are traveling across, for example, from other states, or even for now, some of reports also showing that even people coming from other states, the neighboring Nasarawa, for example, they are coming to receive our services. So our services are available for everyone, and we are expecting that since we do not have any like limitation for anyone and restrictions, all the people are equally receiving the service, unless those who are not able to arrive. For example, the transportation is another cost, very big, very high, and it's very challenging for the IDPs. So the majority of people who are receiving the service could be from the around the community or the camp, but also we are seeing people who are coming outside the camp, and from very far distance they come to receive services in where we are providing. In Benue State in particular, as MSF, from our experience, there is no location that we cannot access for the time being. The only thing that can limit us may be only that we cannot be present everywhere. Based on the limits that we have, we're trying our best, of course, and as I say, we are present in 8 different local government areas, and in 4 different local government areas, and in 8 different sites. In terms of access, we do not have issues so far till now. We work, MSF started intervention in the Benue State in 2018 in Logo LGA, Anyin camp, Anyin IDP camp. That was our first intervention. Then after that, we also expand our medical services to Makordi LGA. Specifically, we've been in Ichua camp, in Abegana camp. Then later on, we go to Gume LGA, whereby now we're having our big presence in terms of intervention in Imbawa, and Ortese camp. These are, and also we have health promotion services in Ukbiam camp. These are in Gume LGA. Then in Guer West also we have present in the Naka. Currently we are doing AGBB support, and also we do medical services in Agagbe area. So these are the 8 different locations whereby MSF is currently present, and these are the 4 different local government whereby MSF provides support for the time being. In the location whereby I just mentioned that we are doing our interventions, in terms of the living conditions is very bad. To be honest, there is a huge gap whereby need support from the other NGOs to come. In Benue, specifically, there is no big number of NGOs whereby can provide services. So in terms of shelter, there is a gap. Like as I mentioned, people are staying in government buildings, and even those who are living in a camps, there is not enough shelter. So shelter is something very essential in terms of protection, and even rain. Benue have a heavy rains, and it affects their health. That is why we do construction of over 2,000 shelters in only one camp, or the camp. Also, in terms of the other needs like food, also because they are not able to go and cultivate. When they go out and cultivate, they face all these protection issues. So food also is an issue, and they do not have a livelihood things like there is no jobs, employment. They are not having any income generation activities. There is no NGOs who encourage. There is people who are really ready to do that, but nobody. There is no NGO there to support them, start up grants, something like that. And the other issues also in terms of health, we provide in the area that we are doing our intervention are better off, but the other location whereby we are not there, they're having serious need in terms of medical services, and also water and sanitation. Sometimes there is some NGOs come construct, for example, sanitation facilities, water sources, but there is no running cost. All these facilities in the camps, especially you have a huge number of people who are living together, they need running costs. For example, repair, rehabilitation, maintenance. Sometimes even the number of the people, because of the new influx, increases, and these facilities are not enough for them. So this is also another big gap which is present for the time being. Apart of that, also we also seen like these other protection things that I mentioned. The people have willing to go out to do farming, but there is not enough protection for them. Even internally in their houses also, maybe it is good that if there is a kind of protection that the IDPs have. So those are some of their situation in terms of livelihood, in terms of their living conditions, and in terms of the services that lacking, and some of the locations, if I can give names like Ichwa, like Naka, Agagbe, in Kwande, in Anyi, these camps currently they are seriously need in immediate now like a shelter, which is very, very difficult for them to stay in those difficult locations. I mean difficult situations in terms of shelter specifically. We are present there for since 2018. The medical organization MSF, we're providing support, but also we already seeing a lot of other gaps. Being all those IDPs can recognize it, our first appeal to the other NGOs and other humanitarian actors and the government is that in these camps, there is huge needs. First of all, like as I mentioned, in terms of shelter, in terms of food, in terms of free health care services, in terms of protection, in terms of water and sanitation. These are the key things these are the basic needs that they really need to provide as soon as possible, very urgently, that these people, they need this support. So we appeal and we strongly advise and advocate for the IDPs that the government is very good. That recently I have attended a government coordination meeting whereby they are yes, really wanted to support. So we encourage those kind of initiative and the discussions and recognizing the IDPs camps, but also we need to see actions in place on ground that these IDPs get enough protection, get enough, at least is the basic needs that they need. For example, sometimes even some situations like people travel from very, very far away a location to come and access our services, whereby we are providing services. So we really advise strongly the other humanitarian NGOs or the humanitarian actors to immediately come and provide also services to those who are living in a very precarious and difficult situations in Benue State. We are there with them every day and every now and then, and we are in the really like become very close to them. So in terms of willingness, they have willingness to go. And I think also I attended one of the meetings recently have been organized by SEMA Executive Secretary, whereby there is discussion about like resettlement, these kind of things. But they will still remain discussions and also like ideas. But for the time being, I don't know exactly, I have no idea exactly, but the IDPs are really willing, for example, to go back. That is, if from my understanding, I cannot say exactly whether they can go back there, the situation is safe or not safe, but to be honest, they are willing to go back, and even the state emergency management agency also in several meetings that we have interacting with them, meeting with them, also they discussed with us that they are having these plans of resettlement, even not now, maybe in the near future. But I don't know, I don't have date, I don't know when and how it will happen. But several times I hear the SEMA executive director mentioned about these resettlement ideas. The thing that need to be done is that first of all, in terms of like the current administration on for SEMA, they are really very, very, very active in terms of reporting, collecting information, organizing, sharing with the actors. So first thing is that to organize in terms of, for example, what is exactly needed, like as I was mentioned about the basic needs and the protection that they need. Then after that, the relevant actors and stakeholders need to also to be involved with. They need to take part of it. So they will be contributing in terms of supporting the government on the resettlement, something like that. And the other things also maybe in further involvement of the IDPs themselves also, that how they feel, maybe something like that, how they feel, are they comfortable, all these kind of things it need to be discussed. I think involving them, involving the relevant stakeholders, having the right information, then after that will be easier. And of course, the most important thing in terms of funding to resettle people requires a substantial amount of money that requires for this big action. So those are some of the points that maybe need to be considered as well. In terms of the real situation and where and what is actually being shared, maybe in terms of in media or with the people outside, maybe the people do not have the real picture. So our appeal, our advice is that maybe it is better people to come and see what is happening. And that is why in several meetings, we normally say that it is very important to coordinate all our efforts, including the advocacy, including the trying to invite other people to come and see, at least also cartel visit, conduct cartel visit to understand the situation. So the real thing is that the needs on ground, especially in the camps, versus maybe people, the other people knowing about what is happening in Benue State, especially in terms of IDPs and their needs, is underreported.